Hello, I am Dr. Shruti Desai, consultant rheumatologist at Vydehi Super Speciality Hospital, Mallya Road, Bangalore. So arthritis is when there is a inflammation within the joint which causes pain and stiffness in the joints. Now there are various reasons why this arthritis can be caused. One of the commonest reason everybody knows is degenerative changes, what occurs because of the age process. Everybody knows that as you age, there will be some wear and tear within the joints, and that leads to arthritis, and this is what we call the degenerative type of arthritis. Now there is a different type of arthritis which is because of the autoimmune process within the body, and this is what we call the autoimmune related arthritis or the inflammatory type of arthritis. And these are the two predominant arthritis that we commonly come across. Now there are other reasons why arthritis can also happen. One is post-infections that we commonly see either because of certain viruses like chikungunya or any other infections for that matter. And other type of arthritis is because of certain deformities within the joints itself, which can happen during the birth or because of certain traumas later on. And so these are the predominant 4 types of arthritis we have. So the rheumatologist, he's a super specialist who is essentially a physician who has trained in dealing with inflammatory type of arthritis and autoimmune conditions. Now you can ask me what's the difference between a rheumatologist and an orthopedician. So orthopedician also deals with the joints and the bones, and the rheumatologist also deals with the joints. But the main difference is orthopedician is a surgeon who manages the joint diseases which is probably related to the trauma or certain injuries. Whereas the rheumatologist deals with the arthritis, which is more of an inflammatory nature or the autoimmune in nature. The autoimmune conditions when we talk about, so these are certain set of disorders which are predominantly because of discrepancies in the immune system. So see, we have an immune system which is predominantly there to fight against infections. So you can acquire viruses, bacteria, and to fight against these infections, we have an immune system which works very precisely. But what happens in autoimmune conditions is, there are, because of certain reasons that are unknown, there are certain changes within the immune system that they start producing antibodies which start attacking the own self proteins or the self tissues. This causes inflammation in various parts. Predominantly it causes inflammation within the joints, so that presents as arthritis, but it can also cause inflammation within the internal organs, say for example lungs, kidneys, or even the brain tissues, and sometimes it can even present as a skin manifestations. So overall what it describes is, because of the discrepancy in the immune system, there is a state of inflammation that is set within the body, and that presents in various manifestations. Yes, there is definitely a treatment for autoimmune conditions. The treatment varies, and we have an array of medicines. There are a lot of advances that has happened over the years, and now we have different set of medications to treat autoimmune conditions. One, they come in the form of non-steroidal anti-inflammatory medicines, or you have what we call disease-modifying medicines, and we have even biological group of medicines which are essentially certain monoclonal antibodies which are meant to fight against certain inflammatory markers. So the bone health, as we say, the whole bone, when we talk about the whole skeletal system, when we talk about, it is the main structural support for the human body. We are all erect human beings, so we all walk on 2 legs, unlike the other species on the earth. So it becomes very important that our skeletal system is in good shape. And what determines this skeletal system or the bone is good amount of calcium, good amount of vitamin D, and also a regular exercises. And this exercises and it starts from very early in the age, and the more you exercises, you can keep your bone health very healthy. Again, as I just mentioned, these are the factors: the calcium, vitamin D, and good physical exercises. See, as I mentioned earlier, the bone health, we have to start taking care of the bone from a very early in the age group. So I am talking about as early as childhood. So good regular exercises, good physical activity is very important for the bone to be healthy and for the joints to be healthy as well. So the right amount of the calcium, the vitamin D, and physical form is what is going to affect the bone health. Physiotherapy becomes very important in the management of arthritis. As medicines are very important in the management of arthritis, physiotherapy is also equally important. How physiotherapy helps is in a setting of a chronic inflammation or chronic pain. Physiotherapy in the form of strengthening exercises, free exercises, or even other therapies such as ultrasound massage or IFT, they all help in a long way One, to control the inflammation, and number two, to reduce the pain. So as I explained earlier, the rheumatologist is the one who manages the inflammatory condition and variety of other musculoskeletal problems. So when to consult the rheumatologist? If you have a joint pain for a long time, say for example more than 2 months, if you have early morning stiffness, you have joint swelling, you have any skin rashes that come on, you have persistent fatigue, fever, or the general physician you go to kind of suspect that you have an autoimmune condition, that is when the rheumatologist consultation can be done.